Bismillahirrahmanirrahim. Assalamu alaikum. Hi viewers, this is Dr. Gufran Babar, endocrinologist in America. I welcome you to my YouTube channel. Today's video will be on how to prepare for PLAB-1 exam, tips and tricks to pass the exam on the first attempt. This video will include a detailed understanding of PLAB exam, especially the PLAB-1, which is Professional and Linguistic Assessment Board Exam 1. The exam is first step in order to get license to practice in UK. So before we go forward, please watch all of it, all the video. I will give you detailed tips on it. Please like this video if you learn something, and subscribe to my channel. And my upcoming video would be on PLAB-2 exam. So let's start with our video. So this exam pertains to best practice in UK and the equipment which is used in UK, and the answer based are based on the published evidence. So it is kind of an evidence-based medicine as well, and it covers the common acute conditions which you are faced with in the ER and management of some of the chronic conditions, but it does not cover those things which are covered by the GPs. Before you apply for the test, you make sure you have the degree. For international medical graduates, the question is, when should they start preparation? They can start in the final year of their medical school, which includes the clinical subjects. And when we will discuss the books, you will see that they pertain to the final year of medical school. And once they pass, they have to get a certificate of completion or degree, and they have to also get the medical transcript. And after that, you have to apply for the IELTS exam, which is International English Language Testing System, to demonstrate your proficiency in English, which is important in order to before you register for PLAB-1 exam. And you have to get the scores for the exam. And the IELTS exam includes the speaking, listening, reading, and writing assessments. And on each of these assessments, your score should be greater than 7.0, and overall your score should be greater than 7.5. So once you have done that, then you set up a GMC, General Medical Council online account, and where you will be asked about the primary medical qualification. You should have a valid passport number, your postal address, and email. The fee for PLAB-1 is £239 as of April 2020. If you cancel the exam, within 57 days, you get 100% refund. Between 57 and 83 days, up to 50% refund. If you cancel the test after 83 of your days of your application, you are not eligible for any refund. Other than the IELTS, you can also take OET, which is Occupational English Test. When you are registering for the online GMC account, they will ask about your username. You'll set up a password, date of birth, gender, degree, medical school, and the medical school, it should be in the list of medical schools in UK. And if it is not there, then you have to email them and see if it would be possible for you to take the PLAB-1 exam. Then you decide about the venue of the test closer to you, and you have to pick a date outside UK, maybe taken twice a year, but it varies from country to country. In UK, there are several options. So if you are outside AK or UK, then you have to be very, very quick. And make sure plan in advance. If you want to take exam in November, make sure you register in May because there are limited number of seats and there may be repeaters as well. So there will be less venues that would be available. Once you have registered for the exam, say you have May, June, July, August, September, October. So you have about 5 months and you take exam in November. So first things first, you have to download the PLAB blueprints. The PLAB blueprints has a detailed list of the topics which will be covered on the exam. Everything will be explained, that which topics you need to prepare for. You should also learn or read about good medical practice, which is the core of the exam, ethical guidance, that you should make sure you don't copy the questions and distribute the questions. When you, on the day of the test, make sure you are not late by more than 30 minutes. Try to be there 30 minutes in advance. And you would need preferably a passport for the identification. And if you have changed name after your medical school degree, then you need your marriage certificate or some other form of identification. You should bring HB pencil, eraser, and a sharpener. Water is good if you can bring, or a protein snack. It is advisable that the day before the test you eat well, have a good breakfast, do some exercise, sleep early. On the day of exam, make sure you have a good breakfast with some protein and fat, preferably with have a cup of coffee to keep you awake. You should not bring any smart watches or special coats. You can have a pullover light. Do not bring a calculator, telephone, or any cell phones or smart electronic devices. If you are sick, you have to tell the invigilator. If you're not well, you cannot take tests. Familiarize yourself with the misconduct behaviors. No posting or sharing of information or screenshots of the test questions. So exam itself is a 3-hour test in which you will be given 180 questions with single best answer. So you will be given a clinical scenarios. You will have 5 options to pick from, and you have to pick one answer. And sometimes the scenario could be long. Make sure, what I used to do when I was taking my USMLE step, that I would read the last sentence of the scenario and then go back and restart reading, because sometimes the last sentence could be, what is the side effect of paracetamol? So when you're reading the answers, if it says hepatotoxicity, you can easily pick the answer, instead of reading all 5 or 6 lines of the scenarios. So read the last sentence of the scenario and the options in the answer, and then go back up and then read. And remember, you have 1 minute to answer each question. So the tests usually take place at different places. They happen in Pakistan in 2 centers, Islamabad and Karachi. India has 4 centers. Other places where you have centers in Bangladesh, Sri Lanka, Saudi Arabia, UAE, Sudan, Nigeria, Ghana, Egypt, Canada, and Australia. So the questions are related to diagnosis, investigation, management, results, and treatment. So you will be tested on these subjects. Most important thing is that you follow the blueprints, which will have all the guidelines how to prepare, which topics are covered in this exam. So in terms of the material that you have to gather for preparation, first thing is if you are starting in the final year, a book which is called Oxford Clinical Handbook of Medicine, which is 10th edition. Ian Wilkinson and Anna Goodhart are the authors. So you can start reading that in final year of medical school, or you can start reading it in your house job. The 1 year house job that you do, you can read this book, and that will be very handy in terms of your test when you will take it after your house job. So pick up this book. So that is the first thing that you need to read as a base for the exam. There are ethical questions, so you can read 100 cases for medical ethics. Psych questions, the psychiatry, you can read the Kaplan, and PLAB keys is good, and some pharmacology from USMLE Step 1 First Aid book will be useful. So this is your basis, and if you have some surgery questions, you can read a review book on surgery like Board Review Series. But most important part of this exam preparation is the questions. The more you will practice, the more you will learn. So if you have, say, 5 months for this exam, you should go through, if you are working, meaning you are doing a job, then you should have at least 5 months. If you have dedicated time after your house job, I think 3 months should be sufficient. So in the morning, you can read your text material like Oxford Clinical Handbook of Medicine, and which could be 5 to 6 hours in the morning, and in the evening for 6 hours you can do the MCQs. The sources of MCQs are PLAB-able, which is an online up to 2000 MCQs, which you can get the subscription for up to 3 months or 5 months. The cost for 3 months is £20 from what I've reviewed, and £25 for 5 months. So there's not much difference in cost, so you can get that. If you don't have that access to PLAB-able, then you should go for the Khalid Saifullah's 1700 MCQs that you can do. The advantage of PLAB-able is that it has got mock tests that you can take, and during the last 15 days of your preparation, I would strongly encourage you to just do the MCQs. Other things for mock and tests, there are Samson's mock, Swami mock. So those are the other thing. Recall questions, if you join on PLAB-1 preparation, Facebook groups, you can get them, and Facebook groups really help. The other thing which helps is that you should have study partner, a friend, or a group of friends that you can discuss things at the end of the day. Say you studied cardiovascular medicine, you can do the MCQs on cardiovascular medicine. And when you are doing the MCQs, remember, if you miss a question or you have to guess too hard on a question, so that is a topic which is your weak link. So strength of a chain is on its weakest link. So you pick that weak link and make a flashcard. You write the question on one side and the answer, and start making your flashcards, say 10 flashcards a day, so that at the end of your preparation for 3 to 5 months, you will have sufficient number of flashcards you can review. And during your preparation, go through your flashcards off and on, so that those weak points that you are weak on, you can hit on them. And if you have to review those topics, say in Oxford review book, you can go through, or any other review book that you want to do that. So these flashcards and a study partner, they will be able to help you in your preparation. PLAB 1700 Khalid Saifullah's MCQs are available in Pakistan on Book Plus for 925 rupees. The PLAB Doable is another book which is for rupees 1899, which is 2-volume book. PLAB Digest 799. First Aid for PLAB is rupees 2049. So all these things, whatever you pick, stick to 2 resources. First is your Oxford book and couple of MCQs like PLAB-able and Khalid Saifullah. If you don't do PLAB-able, then the other books that I mentioned would be useful for the review questions. PLAB prep courses are available in certain countries, in UK, maybe available in Pakistan. So those things are useful in terms of your preparation because sometimes the key points are highlighted in these groups. So the other thing is do not skip any questions. There's no penalty for guessing. And when you're doing questions, just don't leave any question because it's possible that you may not have any time to come back to that question again. So just decide the best answer that comes in your mind in first go and answer it. And you can write that question number on your sheet somewhere that you want to come back to that question. But otherwise, make sure you answer. There's no penalty. So other good thing about this exam is not that hard. You are not competing in terms of score for anyone because it is only a pass-fail exam. So that is the good thing, that you will not be competing on the score. You don't have to score greater than 95th percentile or 90th percentile. You just need to pass. And results usually come back in 6 weeks, online, pass or fail. And the scores are up to 110 to 115, sometimes up to 130. And most important thing is the time management. So when you do these practice tests, make sure you, in the last 15 days, you practice these tests at least 2 times a day, which will give you a speed so that you don't miss any questions, and will give you a technique how to answer questions. And it is important that when you get the prescription or when you get the subscription for the PLAB-able, it should not end sooner than exam date. So make sure it may go a day or 2 after the test, because during the last 15 days, you need to do those PLAB-able questions and the Khalid Saifullah's 1700 questions. The more you practice, the better your speed and the better your chance of passing this exam on first attempt. Make sure that you are always discussing the difficult topics. The more you will discuss, the more you will be able to answer these questions. Once you pass the PLAB-1, then you will be eligible to apply for the PLAB-2 test. The scoring system is Enghoff method, which include one standard error of measurement, because there are people who are at different level of their training, and based on that, how were the questions, how many people answered a specific question correctly, this pass-fail exam result is reported. And if you need to recheck your scores, 47 pounds are needed, and make sure that you do that if you think that you will need a repeat test. I will make another video on PLAB-2, which is OSCE based objective structured clinical exam, after which you'll be able to apply for registration and license to practice in UK. As far as the passing is concerned, you are given 4 attempts to pass on part 1. If you fail, then you have to complete another year of training with certificate or degree before you can retake. PLAB step 2 is also 4 attempts. And if you are not able to pass the PLAB-2 in 4 attempts, you may have to retake the PLAB-1. Or if more than 2 years have passed and you have not passed that PLAB-2, you have to retake the PLAB-1 exam again. And results will be visible in 4 to 6 weeks, and in 4 weeks for PLAB-2. Usually the months of March, June, September, November are available, like I said, but it varies from country to country when you can take exam. But most important thing in a nutshell is that you do your review books, do your questions, make sure you plan whether if you have full-time dedicated time 3 months, if you're not don't have dedicated time 5 months. Use online resources, join a Facebook group, discuss questions with them, discuss answers and questions with a colleague, clear your concepts, make your flashcards. And if you do all this, you have reviewed the book of Oxford Clinical Review, you can surely pass this exam. But practice these questions all through 3 months or 5 months, whatever your target is. And during the last 15 days, just go through the questions about 10 to 12 hours a day. Review your flashcards. Discuss anything that you are not sure with your colleague. Use Google to find out things that you don't know. So these will be your resources. And if you do follow these steps, you will be able to pass the PLAB-1 exam in first attempt. So my best wishes are for you. Best of luck. You can do it. Stay confident. Tell yourself what others have done, I can also do it. Once you tell yourself, stay confident when you are studying, make sure you talk to yourself, tell yourself, whatever I am studying, I should remember forever. So when you trust your brain, you remember things. If you don't trust your brain, you are confused, you are too worried, you are too anxious, things will not stick in your exam. Trust your abilities, stay confident, and believe in your competence. I wish you best of luck. If you have learned something from this video, please like this video, subscribe to my channel, share this video. God bless you. Sallallahu alaihi wa alihi wa sahbihi wa sallam. Thank you.